So here I am with two colleagues from our podiatry service. I've got with me Amanda, who does all the bookings right across the county for people needing to use the service. Busy lady.
Yeah.
And Jack, who is doing a podiatry job for the first time in the NHS as a clinician.
Yes, that's right.
You worked for the MOD before, didn't you?
So I worked for the MOD, doing a similar job, so as a musculoskeletal specialist, and also in private practice. So a bit of a mix, but never for the NHS before.
And what have you found it like? What's it like?
It was a change at first, getting used to working in a far bigger organisation. Seemed even more so than the MOD. But yeah, all very positive so far. It's been about 18 months, so...
Yeah, well, it's bigger than the Red Army, the
Yeah.
NHS. I don't know if there is such a thing as the Red Army anymore, but... So yeah, it's kind of big. How about you, Amanda? Because you're new to the NHS.
Yes,
as well,
I've been
aren't
with the NHS about 18 months now. I worked for Revenue and Customs before, so it has been, a bit of an eye-opener. Yeah, it's good to see both sides of the National Health Service.
So you've been collecting the money that we can spend then?
Yes.
Yeah. I'm not sure if you're poacher or gamekeeper.
No, it's true.
So it's such an important service for people, and in fact I'm coming to use it soon myself.
Oh, right.
Yes, I've knackered my Achilles tendon, and Jack has already told me off because I've got the wrong shoes. Bad shoes,
could be better.
Hopefully you'll be able to put me right. Anna, you're a school nurse.
Yes, that's right. I am.
Tell us a little bit about what your teams have been doing.
Well, our teams are involved with drop-ins, and one of the new initiatives that we've got at the moment, or recent initiatives, is Chat Health. So that's the poster there, and this was a poster created for children, and it's about a text-in service for young people and children to get advice in an anonymous way. Mm-hmm. Hopefully it'll encourage them to engage a little bit more. Mm-hmm. And also we've got some new sort of cards here that are for staff and parents and families, just to give us some advice, quick and easy advice, and refer them on to various places. Brilliant. So that's some of the initiatives we've been involved in.
And it's such an important service because it's where children are.
Absolutely, yes.
So it gives you direct access to them in quite a unique way, really, doesn't
Absolutely, trying to catch them in schools and encourage them to come and see us and to use the drop-in service. Yeah, it's very important.
Mm. And Matt, you are involved with the children's community nursing services, aren't you?
Yes, I'm involved with the Children's Community Nursing Services, so that's the Children's Community Nursing Team. So we offer nursing care to children in the community to allow them to leave hospital early and to keep them out of hospital settings, to allow them to receive care closer to home. Over the last year, we've provided care with difficult circumstances. So we've had floods, we've had snow, and we've continued to offer that care in various places through initiatives that GCS have done, such as the Yeti scheme with the 4x4s and people being driven around to ensure care could be delivered. And we're also offering care in school settings to allow children to access nursing care easily whilst at school, to not require them needing to be seen in the home setting.
Yeah. But some of the people you're working with are in really very difficult circumstances, aren't they? End-of-life care with small children, for example. Yeah, Tell us a bit about that.
We also offer end-of-life care, so if there's children in the county who unfortunately at the end of their life, we offer an on-call service, so 24 hours a day, 7 days a week, where we can go into the home to offer the support that's required. That'll be medication, talking to families, advice and support, ensuring things are set up to allow an easy transition for them.
Sonia, you've had some really important roles in the Trust over the years, haven't you? So starting off in sexual health as a nurse.
I always say when I introduce myself that I feel very proud. I'm very proud to be a nurse. And that's the first thing I always say to people, but equally I feel very privileged to do the role within Gloucestershire Care Services. So I was a sexual health nurse and came on to secondment in 2014 into the role of listening to action lead, and that for me was mainly around that autonomy of giving staff the voice to put them at the centre of change, around quality improvement so we could make life really and quality of care better for our patients, for our staff, and really for everybody working within the trust. I think a highlight for me was after the 3 years of really hard work of myself, my predecessor, Claire, it was very much around when we got the LIA accredited kite mark, which we were the first community trust to get that in December 2016. And I remember at the time, you know, when Paul Jennings was talking to the press and we had some national press coverage around it, it was never about him. It was very much around actually this is about the energy. I think the words he used were energy, creativity and dedication of the staff within the trust.
I'm here now with Lisa, who's a senior dental nurse, and it's a dental service with a difference, isn't it, Lisa? It's not your average high street dentist we're in here.
No, it's not. We are the community dental service, so we provide dental care to people who have difficulty accessing care on the high street dentist. We can offer lots of different things that they can't. The wheelchair tipper, for example, inhalation sedation. But we also have a group of staff who are very skilled at treating patients with additional needs.
Yeah. So we'd be talking about maybe people with learning disabilities or dementia or major phobias.
A whole wide range.
Yeah.
So we also offer home care for patients that aren't able to come into the clinic. So a lot of dementia care. Learning disabilities, phobics, mental health. We do a homeless healthcare session as well.
Right, yeah. Oh, brilliant. So I know you've been one of the people that's been around for quite some time.
Yes, you could say that.
So tell us about all the different organisations that you've seen come and go.
So when I started, I worked for Cotswold and Vale. And that was in St Paul's Clinic in Cheltenham, still for the community dental service. I've been through Gloucestershire PCT and then Gloucestershire Care Services. But I have to say the name changes seamlessly and our service continues. It never really affects how we treat our patients. It's just sort of something that happens in the background really for us. But we are looking forward to our new merger. We're really looking forward because with Together, there's a lot of services that we work closely with already. So actually that integration is going to be really good for us and for our service users.
Over the years of the Trust, one of the things I think we will almost remember is Health and Hustle. Tell us about how it started and where it's up to now.
So Health and Hustle started off with recognising my own long-term health condition and actually taking control, taking a bit of control myself and, starting to get active. And I just had, a thought that actually, I can do a lot more with this. And when I first got my first Fitbit, I noticed other people around the trust that had it, and I thought, well, let's see what we can do with this. And what I didn't realise at the time was the added value that we could get from it, such as being able to speak to colleagues as well, meet people that you've never met before, and it also helped you with your own work as well. When you had, for us, a systems issue that we were able to actually go and speak to the people we knew, and from that part, it started to get really big. So I really took a chance and got in touch with Fitbit to say, I've got this idea, a bit of a dream, and like they say, dreams do come true. And we were lucky for Fitbit to set up a call with us and listening to what we were proposing to do, offered us the Fitbit Health solution, which was absolutely fantastic. So it allowed us then to really bring people in, because the app at the moment only allows you up to something like 10 people in any challenge, and what this allowed us to do was really reach out, but not just within Edward Jenner. It allowed us to reach right out across the whole of Gloucestershire.
I'm at the ward here at Tewkesbury Hospital now, and with me are Sue, Jenny and Sharon, all of whom have worked here for quite some years actually, and some of you remember the old hospital, don't you, before this one opened in 2013.
That's right.
So you were involved with the move, and I can remember even before the move, the year of the floods, when we had to literally evacuate people in boats and take them to the forest for safety, which was quite a drama. But the move, it had its dramas as well, didn't it? Tell us what it was like.
Well, there's quite a lot of preparation work before we moved from the old hospital to here. And as obviously the old hospital had been established many years, so during that process we were discovering lots of boxes of equipment which were no longer needed, lots of basically good sort of housekeeping and a time to clear out and have a good sort out, really.
Yeah, well, we all do that when we move house, don't we?
That's it.
But it was on and off for quite a while, I seem to remember.
It was.
Sue, do you remember what that was like?
Yes, I do remember. Yes, when we were moving, we were carrying boxes over, and then somebody higher up said, "No, you're not moving." So we turned around and went back again. I think it was about 3 times. So we got here eventually.
Yeah.
So,
and there was the saga of the lifts.
Saga of the lifts, yes. Saga of the lifts, There was quite a lot of sagas, and yes, there was anything with the new building, I suppose you have,
absolutely.
don't you? So,
and then we had the opening with Princess Anne as well. Were any of you here that day?
Yes, I was here that day.
Yeah? Tell us what that was like. Did you get to meet her?
Yes, I did get to meet her. She came into the day room and met some patients. She seemed very nice and seemed quite enthusiastic and keen, positive for the hospital, because obviously Gloucestershire's her home.
Yeah.
So it was nice to meet her. The patients got very excited by the whole thing, so... Yes, but it was good. It was nice to see her.
I mean, she's been a great supporter of the Trust, actually, because she
Yes,
opened the Vale Hospital as well, and she was there just recently, actually, opening the stroke unit there. So she's really been a big help to us at times. But you have a bit of fun here sometimes too, don't you?
Sometimes.
Tell me, how did you get infection control to agree to have an alpaca here at Christmas?
I think we still don't know.
Speak to Julie Ellery about
Yes.
that one.
I think she just said it was happening, and it happened.
So did any of you have to walk round behind the alpaca with a bucket?
No, apparently he's very well trained. So, and we had
lift trained.
He's
Went
lift,
for the lift.
yes, and no accidents. So
No.
he was lovely. Yeah, and really, obviously, lifted the morale of the patients here.
Yeah.
Christmas time, it was really exciting.
Absolutely.
Yeah, really lovely.
Brilliant. Oh, some great memories. Thank you very much for sharing them.